Hello everyone, I Mrs. Anpurna Adile welcome you all to this massive course on industrial safety and fire safety management. In today's lecture, we will see our module 9 lecture number 28, that is occupational health and hygiene. This is the various content which I am going to discuss today, like what is the occupational health and hygiene, importance of occupational health, occupational hazards, occupational disease and their preventions, workplace safety measures for preventing accidents and injuries, regulatory compliances, promoting a healthy work environment, importance of training and education to employees, benefits of a healthy workplace, challenges and their solution, and at last we will discuss the conclusion. Let us see our first topic, what is the occupational health and hygiene. Occupational health refers to a overall well-being and safety of employees in their workplace. It involves identifying and managing workplace risks to prevent illness, injuries, and the promotion of overall health among the workers. According to the World Health Organization, occupational health should aim at the promotion and maintenance of the highest degree of a physical, mental, and social well being of people at work in all occupations and prevention among workers of departure from health caused by their working conditions. Let us see what is hygiene. Hygiene in the context of the workplace includes practices and measures that maintain cleanliness and prevent the spread of a disease or contaminants in the work settings. Now, let us see why occupational health and hygiene are essential in the workplace. For employees' well-being, a healthy and a safe workplace contributes to a physical and mental well-being of employees. Therefore, it is essential. Next one is to increase the productivity. A safe and hygienic workplace leads to a higher productivity due to the reduced sick days and accidents. Third one, for the legal and ethical obligations, means the legal and ethical responsibilities of employers to provide a safe working environment is most essential. Next one is reputation, means to maintain a reputation, businesses with a good health and hygiene record often have a better reputation which can attract customers and top talents. Next one is for compliances, means not compliances with the health and hygiene regulation can result in a legal consequences and number of fines to the any workplace. Therefore, health and hygiene are very much essential in any workplace. Next, let us see the importance of occupational health. Why the occupational health matters? Let us see. Occupational health is a crucial aspect of any workplace. It is important for first for employees' well-being. Yes, obviously we already have discussed in previous slide that occupational health is essential because it directly impacts the physical and mental well-being of employees. When employees feel safe and healthy at work, they can more likely to thrive and enjoy their jobs. Next one is long-term health, means occupational health is not just about avoiding immediate accidents but also about preventing long-term health issues. Unhealthy workplace condition can lead to a chronic illness which can affect employees even after they leave the job. Next one is for employee satisfaction. When employees know their employer cares about their health and safety, it leads to a higher job satisfaction and loyalty to their works. Next, for the legal compliances. Many countries have their own laws and regulations that require employers to provide a safe working environment. Non-compliances can result in a legal consequences, as we already have discussed in previous slides. Impact of a safe workplace on productivity and well-being. Let us see what this topic says. A safe workplace has a significant positive impacts like productivity. A safe workplace can boost any workplace productivity when employees are confident that they won't face any accident or health hazards. They can focus better on their task, leading to a higher efficiency. Next, for reduced absenteeism, means a safe working place can reduce absenteeism of any employees. When employees are healthy and safe, they are less likely to take sick days or suffer any injuries that lead to time off work. Next, to improved morale. A safe working environment contributes to improved morale. Employees feel more valued and motivated when their well-being is prioritized. Next, for a lower turnover. Employees are more likely to stay with a company that prioritizes their safety and health, reducing turnover rates. Let us discuss some statistics or case studies. First one is workplace injury statistics. In the United States, there were approximately 2.7 million non-fatal workplace injuries and illness reported by private employers in 2020. According to the Bureau of Labor Statistics (BLS). Globally, the International Labour Organization (ILO) estimated that there are around 340 million occupational accidents and 160 million work-related illness annually. Second case study, fatal workplace injury, means according to the BLS, there were about 5,333 fatal workplaces injuries in the United States in 2019. Globally, the ILO reported approximately 2.8 million fatal occupational accidents annually. Third one is cost associated with workplace accidents. The cost of the workplace accident and injuries extended beyond medical expenses and include lost productivity, workers' compensation, legal fees, and insurance premiums. The National Safety Council estimated that the total cost of work-related injuries in the US exceeded $170 billion in 2019. According to these, we can say how any injury and accidents impact the workplace according to the cost. Next one is impact on a workers. How these data impact on the workers, or these injury and accidents impact on workers. So workplace injuries can lead to a physical and psychological demotivation for employees, affecting their quality of life and long-term well-being. Injured workers may experience pain, disability, and limitation in their ability to perform daily tasks. Next, impact on employers. Employers bear the direct or indirect cost of workplace accidents, including increased insurance premiums and the expenses of hiring and training replacement workers. Poor occupational health can lead to a decreased employee morale, increased turnover, and a damaged company reputation. Therefore, occupational health and hygiene plays most vital role in any industry or workplace. Next, improved occupational health are essential. Let us see why the improved occupational health are essential. Promoting a culture of a safety and wellness can significantly reduce workplace accidents and injuries. Occupational health programs that focus on prevention, early intervention, and employee education can lead to a safer work environment. Implementing safety protocols, providing proper training, and enforcing safety regulation are essential components of improving occupational health. Third one is occupational hazards. Here we can see some common occupational hazards that employees may encounter in various workplaces. Some example of these hazards includes first chemical hazards. Exposure to hazardous chemical or substances can lead to a chemical burns, respiratory problems, or long-term health issues. Second one is noise hazard. Excessive hazard levels in a workplace, such as factories or construction sites, can cause hearing loss, that is also known as noise induced hearing loss, and related health problems. Third one is ergonomics, means poor ergonomics condition like unforgettable chairs, poor ergonomics condition like uncomfortable chairs or improperly positioned computer screens can lead to a musculoskeletal disorders or MSTS, such as back pain, carpal tunnel, or syndromes. Third one is biological hazards. Exposure to a bacteria, viruses, or other microorganisms can result in illness, particularly in healthcare settings or laboratories. Next hazard is physical hazard. This may include factors like extreme temperatures, radiation, and electricity, which can cause burn, heat, or electrical injuries. Next one is psychological hazards. Workplace bullying, harassment, and long working hours can contribute to a mental health issues like anxiety and depressions. Let us see what this occupational disease says. Let's focus on a few common examples such as respiratory issues. Occupational respiratory disease can result from exposure to airborne pollutants such as dust, fumes, and chemicals. These examples includes number of disease, which includes first silicosis. This silicosis is caused by inhaling the crystalline silica dust often found in a construction or a mining workplaces. Next one is occupational asthma, triggered by the workplace allergens or irritants like chemical fumes or animal danders comes under the occupational asthma. Next one is asbestosis. This disease arises from the asbestos exposure common in industries like constructions or shipbuildings. Third one is dermatitis. This occupational disease or occupational dermatitis refers to a skin condition caused by contact with irritants or allergens in the workplace. This example also include Contact dermatitis means an inflammatory skin condition resulting from contact with the chemicals, metals or certain plants. Next one is occupational eczema, often linked to a frequent hand washing or exposure to a cleaning agents. Let us see how this disease can be prevented through proper hygiene. So, let us discuss hygiene measures can significantly reduce the risk of exposure to harmful substances. These prevention methods are such as first, hand hygiene. The significance of regular hand washing, especially after handling chemicals or potentially contaminated materials. Encourage the use of protective gloves or proper hand washing techniques. This is also known as a personal protective equipment should be used. The proper hand washing techniques including using soap or warm water for at least 20 seconds, scrubbing all parts of hands and fingers and drying hands thoroughly. Emphasize the need to wash hands after using the restrooms, before eating and after handling potentially contaminated materials. Next, we will see the skin protection. Wearing appropriate protective clothing, including gloves, lab coats, to minimize skin contact with the irritants or allergens. Next one is respiratory protection. The use of respiratory protection equipment such as masks and respirators in the environments with airborne hazards, proper fit and maintenance should be there. Next one is awareness and training. The need for educating employees about the risk they may face in their specific job roles and the importance of adhering the safety and hygiene protocols. Next one is environmental controls. Means engineering controls like ventilation system and dust extraction system which help reduce the airborne contaminants. Next one is reporting and medical surveillance. Means employees promptly reporting symptoms or any health concern related to the workplace exposures. Encourage regular medical checkups to detect and address potential health issue early. Next, we will discuss our topic workplace safety measures for preventing accident and injuries. Safety equipment or personal protective equipment. It means common safety gear such as helmet, goggles, gloves and safety vests should be provided to the employees for their particular task or job. The use of appropriate safety equipment can significantly reduce the risk of injuries in hazardous environments. Next, for the fire safety, the essential elements of fire safety includes the fire extinguisher location and their uses should be properly maintained and trained. Evacuation routes and assembly points should be there. Smoke detectors and sprinkler system should be adopted in any hazardous or fire hazard places. Next, fire drills should be done within 6 months or within 12 months once in every workplaces, and employees training also should be there in every workplaces. Next one is emergency procedures. So workplace should have clear and well communicated emergency procedures in place, such as evacuation plan for different scenarios, like if there is any fire or if there any is a natural disaster. Evacuation plan always should be there in any workplace. Emergency contact information should be also provided and it should be labeled in every places. Next one is first aid kits and designated first aid responders should be provided in every places. Next one is reporting procedures for any accidents or incidents should be there. Next point is regulatory compliances. Means there should be laws and regulation related to the occupational health and safety. These laws exist to protect the rights and well-being of workers, such as first, Occupational Safety and Health Administration or OSHA. OSHA regulation common in a United States. OSHA sets and enforces safety and health standards, conducts inspections, and provides resources for employees and employers. Local and national regulation like Factory Act 1948 in India and Chhattisgarh Factory Rules enforces safety and health standards, conducts inspection and provides resources for employers and employees. Next one is industry specific standards. Certain industries, example construction industry, healthcare or manufacturing industries may have industry specific safety regulation and standards. Compliances with this standard is crucial for any occupational health and hygiene. The legal responsibilities of the employees and employers. Let us see what this point says. There should be a legal obligations or responsibilities of both employers and employees concerning occupational health and safety. First, we will see employer responsibilities like duty to provide a safe workplace. Yes, employers have a legal duty to provide a safe and healthy work environment for their employees. This includes identifying and mitigating workplace hazards. Next one is training and education. Employers are responsible for providing necessary training and education on workplace hazards and safety procedures. Next one is compliance with the regulations. Employers must comply with all applicable safety regulation and standards, including providing required safety equipment. Next one is reporting and record keeping. Means employers often must keep record of workplace injury, illness and safety measures. The importance of reporting and addressing incidents promptly. Next, we will see the employee responsibilities. First one is compliance with the safety rules. Employees are legally obligated to follow safety rules and procedures established by their employer. Second one is proper use of a safety equipment. It's employee responsibility to use safety equipment or personal protective equipments or gears as instructed by the employer. Third one is reporting hazards. Employees to promptly report any unsafe condition or hazards they encounter in their workplace. Next one is participating in the training. Every employee should actively participate in a safety training and follow the guidance provided. Seventh one, our next topic, we will see promoting a healthy work environment. Means let us see how a healthy work environment can lead to a occupational health and hygiene. First one is strategies for creating a healthy workplace culture. A positive work environment not only improves the overall well-being of employees but also contributes to a higher productivity and job satisfaction. Strategies to create a and maintain a healthy workplace culture. Leadership commitment means top level management should demonstrate a commitment to the worker health and safety. Leaders should lead by example and prioritize employee well being. Clear policy and procedures means clear and well communicated policies and procedures related to the health and safety help to stabilize expectations. These policies should cover areas such as safety protocols, reporting procedures, and conflict resolutions. Next one is supportive management. Managers should be approachable and supportive, encouraging open communication with their teams. Work life balance. Management should encourage flexible work arrangements when feasible and discourage excessive overtime. Recognition and rewards. Recognition and rewarding employees for their commitment to health and safety can reinforce positive behaviors. Consider safety awards and recognition programs. Next, let us see role of employees involvement and communication. It means employee involvement and communication are central to promoting a healthy work environment. These key aspects are first, employee engagement. Encourage active participation from employees in a safety committees or work groups. Employees can provide valuable insights into workplace hazards or other solutions. Two-way communication should be there, means open and transparent communication channels should introduce. Employees should feel comfortable reporting safety concerns, sharing ideas, and providing issues with the management. Next one is training and education. Management should provide employees with training and education on health and safety topics. Not only equips them with the knowledge but also demonstrate the company's commitment to their well-being. Feedback mechanisms should also there be introduced. Means employees should have opportunities to provide feedback on a safety initiatives and suggest improvements. Next, we will discuss what is the importance of this training education to the employees. Training and education plays most vital role in ensuring a safe and healthy work environment. Well-informed employees are better equipped to identify hazards, follow safety protocols, and respond to the emergencies. Let's see this in detail. First is a risk awareness. Means training helps employees to understand the risk associated with their role and task, allowing them to take proactive measures and mitigate those risks. Next one is skill development. Means education and training provide employees with the necessary skills to perform their jobs safely and effectively, whether it's operating machinery or using safety equipment. Next one is compliances. Training ensures compliances with legal requirements and industry standards. It also demonstrates a commitment to adhering to safety regulation. Next one is crisis preparedness. Training prepares employees to respond effectively in case of any emergency situation. Next, we will see our topic benefits of a healthy workplace. The advantages that employees gain from maintaining a safety workplace are first, reduced absenteeism. As we already have discussed in previous slides, let us see this again. A healthy workplace is associated with a lower rate of absenteeism. When employees are physically and mentally well, they are less likely to take sick days. Next one is increased productivity. Employees who feel secure and supported are more engaged and focused on their tasks. Third one is lower turnover rates. A healthy workplace fosters employee loyalty and reduces turnover. This in turn saves requirement in training cost. Enhanced reputation. The companies with the reputation for prioritizing employee well-being and more attractive to both customers and potential employees. A positive image can lead to an increased business opportunity. Next one is compliances with the regulations. Means maintaining a healthy workplace ensures compliances with the occupational health and safety regulation, reducing the risk of legal consequences and fines. Let's see what is the benefits of employees for occupational health and hygiene. So employees well-being is not only important for any organization but also for the individual's quality of life. First, improve physical health. A healthy workplace reduces the risk of occupational illness and injuries, resulting in a better physical health for employees. Enhanced mental health means positive work environment contributes to improved mental health among the employees. Positive work environment can lead to an increased job satisfaction and motivation. Next one is work-life balance. A healthy workplace often promotes work-life balance, allowing employees to manage their professional and personal lives more effectively. Next one is higher job satisfaction. When employees feel valued and safe at work, they are more likely to experience job satisfaction and loyalty. Next one is professional growth. Means organizations that prioritize employee development often provide opportunities for skills enhancement and career advancement. Next, we had discussed occupational hazard and diseases. The common occupational hazards and the diseases along with their potential consequences and preventive measures. Next, we have seen safety measures like workplace safety measures including safety equipment, fire safety equipment and the emergency procedures. Next, we already discussed regulatory compliances means importance of complying with any occupational health and safety regulation, the responsibilities of employees and employers. Promoting a healthy work environment also we have discussed means strategies for creating a healthy workplace culture emphasizing a role of employee involvement and communication. Next we already have discussed in previous slides about training and education, the significance of training and education, employees offering suggestion for implementing effective training programs, and what is the benefits of different occupational health and hygiene implementation we discussed, and we explored your knowledge about different challenges and their solutions. So dear learners, this is all about occupational health and hygiene. I hope you explored your knowledge in the field of occupational health and hygiene. Thank you.